My favorite part about working at Mott is being in an inpatient hospital environment and really being able to see how an interprofessional team works in action. There is no shortage of unique, interesting, and complicated patient cases that patients will present with in the ICU. So every time I walk into work, there is always something new to learn, whether that be using my clinical resources or talking to the pharmacists who are always willing to help. And it really is just a humbling experience being able to be in this environment with these kids providing care. And it really helps put things in perspective given what we learn in school and how it applies to kids in real life.
One of the most interesting parts of my job is learning about all the new specialty medications that are coming onto the market. Specialty pharmacy is growing. Each year, more medications are being classified as specialty meds, and a larger proportion of the pharmaceutical spend is going towards these therapies. Last year, while I was applying for the internship, Trikafta, a new cystic fibrosis medication, was just approved. In MedChem, I had learned about the structure of the medicine and its mechanism of action. But working in the specialty pharmacy, I learned about its human impact. I have heard directly from patients how drastically this medication has changed their lives for the better. And that correlation between what is learned in class and the patient's own experience, I have found to be indispensable to my education.
My work as an intern in medication use policy varies a lot from day to day. Our small team runs a drug information service for the health system and also coordinates all of the materials for the Pharmacy and Therapeutics Committee, which determines what medications should be added to the hospital formulary and makes many other important medication-related decisions for Michigan Medicine. My work is mostly project-based and involves a mix of research and writing and data collection to do things like respond to drug information questions, put together formulary monographs, and conduct medication use evaluations. There's a lot of opportunity in this position to tailor the projects you work on to your goals and interests and to work directly with all of the fantastic pharmacists on our team.
So a typical day for us down in B2, we kind of have our hands on every part of the medication distribution for the hospital. So doing inventory and stocking of medications to actually filling and dispensing medications, answering medication messages and answering nurse and doctor phone calls, running medications up to the patient floors, also working in the clean room making IVs and infusions. And then new this year, all inpatient interns have the opportunity to counsel patients on their new anti-coag drugs upon discharge. So one of my favorite things about the internship, especially down in UH, is that every day is different and we have the opportunity to work in all of these different spots, and every day is not the same. So that's probably one of my favorite things.
For the first year as an infusion pharmacy intern, your typical day involves compounding. You're in the hazardous or non-hazardous HD rooms where you're compounding chemotherapy medications for our cancer patients. As a second year intern, your job is more patient-centered. So what you're doing is you're contacting patients to do medication reconciliations. So you're making sure we have all the medications before they come for their chemotherapy regimens here at the Cancer Center.
This internship has shown me the workflow within a hospital setting, but has also shown me how to effectively communicate with doctors, nurses, and pharmacists. This experience has definitely helped me determine my likes and dislikes when it comes to a future career path, and I've also really benefited from the network of pharmacists who have acted as amazing mentors and also great friends.
This internship's prepared me for my career after pharmacy school by really giving me confidence in being able to communicate with patients and have conversations with them, which is not something that I was very comfortable with coming into the internship. But having these sorts of conversations every time I work has really made me comfortable just being able to talk to patients and make clinical decisions on the spot with them on the phone.
And not only that, with my research project, I work with a physician and other pharmacists and pharmacy financial coordinators. So with that, I've gotten practice working together with other healthcare professionals on a team, which is very reflective of what it will be like in the actual pharmacy field when I'm actually a pharmacist. So.
I chose this role because I personally am interested in oncology, but also I feel like you get skills that you don't learn in pharmacy school here, so you learn about a lot of compounding, and you get a little taste of it in pharmacy school, but you really get into it here, so I think that's a valuable thing to take out of this role. Good luck with applying, and let me know if you have any questions. Thank you.
I wanted to work at Mott because I had previous experiences working with kids and at children's hospitals. Coming in to pharmacy school, I knew I had interest in pediatrics because I enjoyed my past experiences, and I wanted to learn more about the challenges of treating pediatric patients. I also felt like I clicked really well with the employees at Mott, and I fit in with the culture of high-intensity work environment of an inpatient pharmacy.
One of the coolest things I've been able to do, and as part of this program, is to assist patients with access issues. So unfortunately, a lot of these medications with oral chemotherapies aren't covered or very expensive. So on numerous occasions, I've worked with patient financial coordinators and the pharmacists to draft appeal letters to go to insurance companies after they deny the prior authorization. So that was me combining and drafting a letter about the patient's medical history as well as any new or recently published research that would prove why the patient should get the medication. So for example, one of the first ones I ever did was a very rare form of cancer, so that took a lot of digging and work, but thankfully it got the access established for the patient, so I could help with that as well as education and symptom management for that specific patient.
So a couple of my favorite things that I got to do this summer was number one, we do a lot of compounded medications in the pharmacy I work for. So I learned how to compound a bunch of medications, and I thought that was a really cool skill to learn, and I really enjoy doing that. And my second favorite thing would have to be when children are being discharged and they have liquid or narcotic medications, we make sure to counsel the family members on these medications, and if they're liquids, we show them how to use syringes and how much they'll be taking each day. So I really enjoy the patient interaction when I'm counseling families.
My biggest advice when applying to the Michigan Medicine internship is to just be yourself. When you're doing your video, it will be about a 5-minute video where you just answer a few questions. I would highly suggest not locking yourself into a script. I would suggest just sitting down and doing it, and kind of whatever comes forth naturally I think is the best, and I think they just really want to see what you are passionate about and who you are as a person. Throughout the face-to-face interviews, I would also just suggest really being yourself and kind of trying to be able to bring up those things that you are really passionate about, especially in regards to pharmacy and kind of what your goals are and how the Michigan Medicine internship could help you reach those goals. And lastly, a lot of the interview questions are situational based, so ahead of time maybe try to come up with a few experiences that you have that could answer some of those questions, so just kind of be thinking of those ahead of time.
Some advice that I have for the application involves talking to current and former interns about the role and what a day-to-day life is actually like. Talk about what it takes to excel in the position. In your CV and cover letter, make sure that you're not just talking about why you want the job, but rather why the job should want you. What do you specifically bring to the role that would make the department better as a whole? Make sure that you have lots of people review your application materials, particularly pharmacy faculty. They really know what a good CV and cover letter will look like. It can be really scary, but it's way better to get criticism now rather than later. And lastly, take your time, relax. There's a lot of other job opportunities out there. Just take this as a good learning opportunity for job searches in the future. Good luck!